he is in a good mood. So you have to watch out his mood. Number 3, see his activity. What kind of activity does he have? Do you think he has a lot of activities or he has no activity? Once you see him sitting alone, isolating himself away from others, just living alone and doing nothing, this means there is something wrong in his personality. It could be because of having this kind of drugs. Okay? When you see him that all the time sleeping or having lack of sleep, that means that he is in trouble. There is something wrong. So you have to ask him, or you have to find out, is he taking certain kind of drugs? If he says, well, his friendship is getting so, it's not like before, it's shrinking, not like before. That means there is something wrong in his personality. So you have to know the early signs of the problem. Once you know the early signs of the problem, it's much better than if you let him, then there's going to be a bigger problem, then the solution will be very, very difficult. So that's why I said you have to know the early signs. I'm not going to exaggerate, but I want to say that every 10 individuals, there are 2 addicts in them. That means the rate of addicts are increasing. The rate is increasing. Not only in male, but also in female. So we have to work hard. We have to work hard. We have to have something, we call it collective mind. Work together in order to reach the solution. In order to reduce, if we are not going to overcome the problem, but we're going to reduce the problem, which is good enough for us. Okay? My colleague, Dr. Afrah Shumri, is going to help me with that. Okay, now, what are cause and risk factors developing a drug use disorders? Okay, if you allow me to stand up. 5 minutes?
Yeah.
Who said that?
They said.
Okay. Like most other people, mental health, the problem is people abuse their drugs. We have to know that there is some benefits from drugs, but if you are, all of us, I'm talking about in general, if we are abusing the drugs, this is a drug addiction. This is drug addiction. So if you have a problem, let's say, if you have a problem in sleeping, you take more than 10 Panadols for a night. This is a problem. So why you are taking too much drugs or too much Panadol for that? Why you're not doing something else? Why? Do you think that we all safe, as I said in earlier, safe from this disorder or disease? Do you feel that we are all? Nobody can anticipate that. We're going to have a problem, maybe just if you have any problem. Let's say if you face any problem and you cannot solve the problem, and you said, well, I feel, now you get in the frustration state or frustrated, you get frustrated and you get depressed. You said the best way for that, this has happened I'm talking in a male, when they get depressed, said, why you are depressed? There's nothing to be depressed for. You have to take just a little bit hashish, and you will find yourself in another state. You will have fun. You will enjoy yourself. So we have to know that there are a lot of ways to solve your problem, not by using any kind of drugs. So we have, maybe a couple of minutes ago, Mr. Ahmed said that. Said we have a lot of techniques if we use them. One of them is the technique that he mentioned earlier. So, but we don't have, let's say, we are not patient enough to say, okay, there are a lot of ways to solve the problem. Why we are going to this kind of drugs in order to solve our problem? Now, do you think that psychology, we as a psychologist, what we are doing, we are trying to understand the problem. We try to analyze the problem and anticipate the problem. What's the results going to be if we could not solve the problem? Okay. There is a great relationship between motivation and drug addiction. Motivation and drug addiction. If you are not motivated to do something, that means that you are driving yourself to go this way, having drug addiction. If you have no motivation. So motivation means that, okay, I have to see myself and my dialogue with myself to be, what am I supposed to do? I have to have something. I have to have a target. I have to work in order to achieve my target. But people said if they have no motivation, means they have no target in their life. So once when they feel there are no target in their life, and they are empty time and doing nothing, okay, so they go this way, or they follow this deadly road. So that's why we said you have to have motivation, and you have to plan for yourself, put a target, then you have to work with that. I think this is one technique if we are going to deal with these people, addicted people. And it's not difficult. We have to say, well, you can change yourself, but you have to change your thoughts. You have to change your mind. You have to change your lifestyle. Your confidence is very low. You have to raise your confidence. Okay? And you have to have what we call it social skills in order to get yourself out of this. So, next, please. Okay. I'm not going to talk about the environmental problem because it's something well known. But let me talk about what age do usually people, adolescents started to have this kind of drugs? What age? Early age means 13, 14. Maybe sometimes less than this age. Maybe they are 10 years, 8 years, and they are new, as you say, new drugs, and it's not well known in the society, but this is a new drugs. But anyhow, we have to know that we have to put our eyes in this, in the adolescence stage, because this is the stage where the people go through this kind of problem, drug addiction. If we deal with these people, adolescents, in this stage, well, understand their needs, understand what they are thinking, trying to put things to them, okay, to give them a time, okay, listen to them, I think, and know their colleagues, okay, that means that we are doing something good. We are trying to keep him in a very proper way. So this is our job. Means family, schools, society, institution, all institutions in the society are responsible for that. We have to work together in order to deal with this problem, in order to solve this problem. Because the early we understand their needs, the early we diagnose the problem, the early we explore the problem, the best we can help them and treat them. This is the thing that we have put in our consideration when we're talking about these people. Okay, I'm not going to go further. I'm going to give you a time if you have any questions, anything in your mind you want to ask about. So I'm pleased to, because this, I think this is, this article is in your, Sarah, is it, did it distribute it? Okay. Huh? Distribute? Hey, Sarah, did you distribute my article?
No, I didn't.
Okay. If you have it, I can give it to you. So, but I'm here to listen to you if you have any problem or anything in your mind regarding our topic. Do you have anything in your mind? Or do you have anything you want to talk about regarding this issue? Okay, it's 5 minutes to ask. Okay, give him 5 minutes to ask.
There is a part of questions.
Okay, thank you very much. It's my glad to have you here. And if you have any question, I'm very pleased to answer it. Thank you.